Alarming new research has discovered a link between smoking and deafness. At a conference in Perth, doctors have been told that smoking 10 cigarettes a day can cause ear disease.
For years, doctors have warned smoking leads to lung cancer and early death. Now Australian researchers have found smoking can also lead to deafness.
The patients that smoked had a three times the increased risk of presenting with a problem with the ear, that is, with either a perforated eardrum, a leak of fluid from the eardrum showing an infection, and also increased disease in the middle ear itself.
The research showed patients that smoked 10 to 40 cigarettes a day over 10 years suffered mild to moderate hearing loss. Symptoms also include discharge from the ear and complications when taking a shower or swimming.
If, by God forbid, this got infected, it can also lead to meningitis, facial nerve paralysis, brain abscesses.
And fixing ear problems also becomes more complicated with smokers. Ear surgery is 3 times more likely to fail if patients light up.
When we smoke, we actually have little hair cells that don't move as well from the cigarette smoke. It actually paralyses the little hair cells, but also changes the way in which the nose and the ear make mucus, and they make the mucus a lot thicker.
Claudia Bertorello, 10 News.
New research has revealed that people who smoke are 3 times more likely to suffer ear disease and possible hearing loss. The research was conducted in America over 18 months by Sydney ear specialist Dr. Zoran Becvarovski. He says that smokers are more susceptible to problems such as perforated eardrums and middle ear infections.
Nicotine can actually cause closing of the small blood vessels to the nerve of the inner ear, and that has been shown to cause some hearing loss.
Dr. Becvarovski presented his findings to an international medical conference being held in Perth.
Smoking can also lead to hearing problems, even deafness.
Obviously hearing loss, but also complications of middle ear disease. And also if they had an operation, there'd be 3 times the chance of failure of that surgical operation.
Sydney Dr. Zoran Becvarovski is part of a team of researchers who studied the hearing of 74 smokers over 18 months at the Michigan Ear Institute. He's told an international conference in Perth that smoking can stop the ear from breathing by blocking the tube which connects the nose and the eardrum.
The cigarette smoke is known to decrease the movement of the little hair cells inside the nose and inside the middle ear itself.
The effects were most prevalent in long-term smokers, but the study also found that hearing in children as young as 15 had been affected by regular smoking. Alison Wisson, National 9 News.